Okay, so what are some of the common unhealthy habits you observe students falling victim to once they get to college?
Okay, first one is they don't get enough sleep. They should get at least 8 hours of sleep. That helps to boost the immune system so that they can fight off different types of infections. They're more alert when it comes to studying and also in class. So definitely sleeping, eating healthy. Once they're out on their own and they're making food choices, a lot of times they'll choose foods that are very high in calories, very high in sugars, and instead of having a nice balanced diet. For some, it may be not getting enough and regular exercise. So those are sort of some of the basics. Now the other pieces that fall into that are risky behaviors related to drugs and alcohol. So binge drinking, being introduced to different types of prescription pills, and then also risky sexual behavior, having unprotected sex with a lot of different partners. And those are just some off the top of my head.
Okay, perfect. And that kind of segues into my next question, which is the abuse of prescription pills, specifically Adderall.
Mm-hmm.
How do you observe students abusing that, and what are some of the risks that go along with that?
I mean, Adderall is an amphetamine that is prescribed for students with attention problems or hyperactivity problems. It is supposed to have a paradoxical effect with people who are very hyper. So you would think an amphetamine would ramp them up, but instead it actually brings them down. So now if you give Adderall to somebody who does not have, let's say, a hyperactivity or a lack of focus, what happens is you speed everything up. So the danger comes in especially with strain on the heart. So it can put students at risk. In fact, when we prescribe Adderall, any person that receives that type of medication usually has to have a cardiac clearance prior to. So now imagine taking the Adderall and then taking other stimulants along with it. You're now raising heart rates, blood pressure, temperatures. So everybody basically they're on speed.
All right, thank you so much.
You're welcome.